do first. Lay down. Alright, so I'm going to palpate for C2. Thank you. All I'm going to do is bring your head to the right, and then I'm going to bring it to the left. Okay, so I'm feeling for the spinous process of C2 in my middle and index finger. And it should move the same direction as the side bend. A positive test would be a delay or excessive motion in the spinous process, usually a delay when you're moving it to one side. This is testing if the alar ligament is intact on both sides. You could also do rotation, doing the same thing, assessing the spinous process. Good. Okay, you're all set. Get up. And then just asking if the patient had any pain with that or anything. So patient comes in post NVA. So they were in a car accident. They had diagnosis would be a whiplash injury, or actually diagnosis would be a hard disc lesion from whiplash. So they state that they have pain with active movement of the neck, so I would say some extension and rotation was limited at end range, had pain. Same thing with passive motion. I did rotation to both sides, just pain at end range, extension, pain at end range. So I did some physical PIVMs and just to see if the joints were moving the correct way together or separate. Everything was fine there. So I thought that the patient would benefit from a grade 5 manip. So to do that, I would have to test the alar ligament, also the transverse and the vertebral artery to make sure that they were all intact and there was no problems there before you did a manip. So I said diagnosis was the hard disc lesion. Tissue at fault would be the disc. The primary impairment would be loss of range of motion with rotation, and the functional limitation, the patient is a truck driver, so she's not able to turn her head when changing lanes, and disability would be the patient cannot go to work safely. Miss anything? Okay, I'm done.